Hello, I'm Dr. James Swinehart, dermatologic cosmetic surgeon from Denver, Colorado. If you could remove unwanted inches and pounds from your troublesome areas, wouldn't you be interested? Well, today we're going to show you the exciting new Tumescent technique for body contouring under local anesthesia. In years past, liposuction is viewed somewhat skeptically as a procedure to be cautious about. Other surgical specialists preferred to perform the operation under general anesthesia in a hospital operating room, adding greatly to the risk and cost and prolonging the recovery time considerably. However, dermatologic surgeons who prefer to perform their procedures in a gentler, softer way sought to discover a method for fat removal that could be performed in an office setting under local anesthesia. In 1985, Jeff Klein, a California dermatologic surgeon, developed and perfected the Tumescent technique in which liposuction is performed with a dilute lidocaine epinephrine mixture. Gradually, the public has become more aware of and demanded the performance of body contouring with this Tumescent technique. And it was this Tumescent technique that was featured on national television in April of 1995, performed by Jeff Klein. Ironically, plastic surgeons and other surgical specialists, in response to a demand for increased safety and quicker recovery, have begun to learn this procedure from dermatologic surgeons and to implement this technique in their own practices. As you know, many operations are performed through small tubes these days. Coronary arteries are unclogged. Athletes undergo arthroscopies on their knees and shoulders. Women have gynecologic procedures performed, and gallbladders are even removed through tiny incisions. The word tumescence means puffing up with dilute local anesthetic containing sodium bicarbonate to decrease discomfort. During this procedure, performed in an office operating room with registered nurses and sterile technique, you will be fully monitored with an IV line, blood pressure monitor, cardiac monitor, and pulse oximeter. A certified registered nurse anesthetist will administer IV sedation to you while the local anesthetic is administered. The unwanted fat will then be precisely suctioned through tiny tubes, crisscrossed in an attempt to prevent any surface irregularity. Bilateral symmetry will be measured in 3 ways: with a pinch technique, by measuring the fat taken from both sides, and then by examining you in a standing position at the conclusion of the procedure. Patients are ambulatory at the end of the body contouring, and many are able to return to work by the next day.
Lori, did you have any worry or apprehension about undergoing this procedure?
At first, I was a little apprehensive about having the procedure done, but no more so than I would have been with any minor surgical procedure. I went back to work the day after the procedure was done, and the recovery period was, minimal. In fact, as time goes by, it seems to be more and more pronounced how well it turned out. It was really better than I'd expected.
Would you do this again?
I would absolutely have this done again, without question.
Would you recommend this procedure to others?
Not only would I recommend it to other people, I have recommended it, and they have all been absolutely thrilled with the results. It was the easiest possible way to get rid of fat.
Here we can see the actual results of our patient before and after tumescent liposuction. We will now take a look at the procedure itself and then examine some of the results that might be obtained. The areas to be removed are carefully marked in the standing position before the procedure with the patient's full and complete agreement. Here you can see treatment of the man's chest as well as his abdomen and love handles. The patient's progress is carefully charted and detailed in the medical record. We use sterile technique with sterile instruments throughout the procedure. The patient is carefully monitored with a cardiac monitor, blood pressure monitor, pulse oximeter, in an IV line at all times in order to ensure maximum patient safety. The tumescent solution is utilized for numbing the patient with local anesthesia. You can see that what we do is kind of grasp the fat between our fingers. That way we can tell, as it's decreasing in thickness, tell how much we've taken. You can see here the pure yellow fat without any bleeding as it's coming out. And we just remove the fat with gentle back and forth motions, and it just gradually suctions it out. And again, people say, well, when you're doing the abdomen, could you hurt anything? Well, actually not, because I can feel the cannula between my fingers here. So that ensures patient safety. The other thing, note that we're going parallel to the skin. We're not going down. We're going parallel to the tissues here. Tom, there it is. There's all those bacon and eggs, quiche, chocolate cake, whatever you like, champagne. The use of tumescent anesthesia provides for the bloodless removal of pure yellow fat, as we can see here. Okay, notice the pure yellow fat there, no blood in that. That's pure body fat. Pretty low. You want regular ended. Feeling okay now? It's pretty numb right now. Yeah, good. Okay. Tom, what kind of sports do you play? Tennis? You played much lately? Pretty nice weather out there for tennis. This patient is a 65-year-old realtor. Liposuction was performed on her saddlebags, hips, and abdomen. She was able to work the next day. This patient, in her late 20s, benefited from gentle contouring of her inner and outer thighs, achieving a near-perfect figure. This man, though thin, looked and felt overweight because of his double chin. Liposuction, as you can see, has made a dramatic difference. Here we can see the remarkable and yet imperceptible improvement in this patient's abdomen. This man was grateful to be able to shed his love handles after liposuction. He'd been unable to improve this appearance with exercise or dieting. This aerobics instructor, in her early 30s, received tumescent liposuction to her knees, inner and outer thighs, visible from behind. The same patient, viewed from the front, demonstrates the type of improvement obtained from tumescent liposuction performed under local anesthesia. I believe in performing just a few procedures, but performing them very well. I have successfully performed the tumescent technique for body contouring since 1987. I would welcome the opportunity to tell you more about this exciting new technique, and you may schedule a consultation by calling 303-744-1202.